Oh my god. This is freaky. Hey there, it's Dr. Daniel Paziev. I'm a dental professional with over 10 years of experience in Manhattan, New York. Today we're going to be watching some dental scenes from horror movies. When I was a kid around 8 years old, my brother and his friend put on a horror movie that literally gave me nightmares for 3 years. And since then, I don't think I've ever seen a horror movie that scared me since. The name of it was Event Horizon. But now we're going to watch some dental scenes from some horror movies. Number 1, Final Destination 2.
There you are. What happened to you yesterday, Tim? We missed you in here.
I got hung up by that accident on Route 23.
Good Lord. How lucky that you're okay. Your mom says you've been having some pain lately?
Not really.
So usually people are so scared of the dentist that they actually downplay the pain. It's called self-denial or self-deception. This is one of the reasons why people lose their teeth very early. They don't fix their teeth on time because of a psychological attempt of self-defense.
I'm disappointed, Tim. Does your mom know you've been smoking?
Uh-huh.
So on the daily, I see patients who smoke. Usually if somebody smokes, it'll damage their teeth after about 5 or 6 months. Sometimes I see either bad breath or I see a discolored tongue.
Wider. How did they expect me to...
So the fact that he's holding his lip like that makes me very nervous. We usually hold the patient's lip with a mirror. We usually do this to prevent jabbing ourselves.
Let me get this started. Now, Tim, you'll be awake, a little groggy, but you're not going to be able to move much.
Laughing gas. It's actually a very interesting topic. Laughing gas is meant for people who are very nervous, but it doesn't remove the pain. This is a common misconception. Laughing gas is meant for people who are very nervous and nothing more. Oh my god. This is freaky. There are so many things wrong with this scene. Number 1, he's drilling his teeth without water. When you drill teeth without water, you actually burn them. Number 2, where's his assistant? She should be helping him. So the nitrous machine, that's actually interesting, where the oxygen shuts off, but the nitrous doesn't. In a real scenario, both would turn off. I got an important question. Why can't the guy move? Nitrous doesn't do that to you. I gotta say, it's pretty damn crazy that that fish fell out and fell into his mouth. How in the world can something like that happen? Oh, it's Final Destination.
Jane, how's Tim doing in there?
This is why they teach us in dental school, never leave the patient alone in the room alone with nitrous. Anything can happen. There's gotta always be someone to watch out for the patient. If I were him, I would have sued the doctor. Maybe. I rate this dentist a 1 out of 10 because of all the things he did wrong. And I give him a 1 out of 10 for multiple reasons. He left him alone in the room, he used his finger while getting him numb, he didn't turn on the water, he didn't have an assistant, he had that mouth prop thing in there, that thing looked wicked. I think he was absolutely terrible and I don't recommend him to anybody. But I gotta say, Final Destination painted an amazing picture and it gave me a lot of anxiety. Number 2, Saw 7, the final chapter, even though they released Saw 10.
Down. You must make your decision quickly.
The chart on the wall is actually pretty accurate. They probably got this prop from a dental school. The tool that he uses on the table is actually the right one, and it's called a forceps. But we actually use that instrument last because what we use first is an elevator. It's like a little shovel.
I don't want you to see this. Baby, okay?
Oh my god.
I think it is possible to pull your own tooth, but you definitely have to be numb, because for something like this, he would pass out from shock.
Game's still on.
So let's start off with this. Usually when we pull a tooth, there isn't that much blood. Since he's pulling out his wisdom teeth actually come out pretty easy. Him doing all those jerking movements is actually making it worse. If you actually see, there's a nerve attached to the tooth, and it's actually a misconception. That's not how it comes out. The nerve actually stays behind. How in the hell in the world is that possible? He pulled his teeth out and there are numbers on the roots? Nah, that's impossible. So the person that did that is not a dentist, he's actually a magician. To be able to do that, you'd have to pull the teeth out, write them in, put them back in the mouth, and that's highly unlikely. I would rate him a 5 out of 10. He actually pulled his own teeth out and had the ability to still get up and punch in numbers. They actually did a pretty good job depicting the movie. I think I'm actually gonna watch this one. Number 3, The Dentist. Even though I've never seen this movie, I'm excited to watch it.
I know you're just gonna do great.
Hi there. How you doing today, Jody?
Fine.
Is this your first trip to the dentist? You a little scared? No? Good. Give me 5. All right, let's go.
Thank you.
I haven't seen the rest of the movie yet, but he was actually nice to the kid, even though he's a little creepy. One of the most important things about when treating patients is to make them feel comfortable before you even do anything.
Jessica, where's the patient's tray?
It's all prepared. I'll go get it for you. Oh, King of the Jungle.
The dentist actually puts in a lot more effort than the one from Final Destination because he is actually wearing a white coat. The dentist also has a mask and an assistant, so he's pretty legit. Let's talk about how they set up the scene. The tools are sealed, the operatory actually looks like something inside of a dental office. So pretty good.
He says, I think it's important for the patient to enjoy a positive dental experience conducive to continued care.
I think it's absolutely true that a dentist should be providing a good atmosphere for a patient. Reason for this is that a negative experience actually turns into a lot of damage over the years and people don't want to go back to the dentist. We definitely want to avoid that. This long-term fear actually turns into a lot of damage on the teeth over time. Neglect is actually one of the worst things that somebody can do to their teeth.
You're doing really good, honey.
So the scene where he's actually picking at his teeth, pretty accurate, I gotta say. That's usually what dentists do. My personal diagnosis for the teeth that we see in the scene, the guy was probably smoking for more than 20 years, never had a cleaning for at least 4 or 5 years. Underneath all that stain and plaque, it was actually pretty healthy teeth from what I saw. At this point, if I were to see this patient, I would just give them a really damn good cleaning and they should be fine.
What did you do? He's bleeding!
Man, that's a nasty scene where the dentist pokes into his gums. But that was pretty accurate. A little bit of blood, it wasn't too much, it wasn't overwhelming. It's on point, even though it's disgusting.
We can't take children anymore. The child is spoiled.
We can't take children anymore? Dude, you messed up. That's all right. You just gotta admit to it, what you did wrong.
Mrs. Sanders!
It's okay, Jody. We're gonna go home.
Now, believe it or not, the fact that the kid is bleeding, it's gonna stop. So she had every right to take her kid and go home because that's scary.
They're okay.
I remember my first time at the dentist. I bit him.
Oh, we charge extra for that.
We can't charge extra for that.
Control. Keep it under control.
The doctor taking pills. Now that's a major problem. When you're a doctor and you're in control of somebody else's health, you have to be in control over your own body.
Just like Matt.
Now I want to talk to you about something serious. It is really wrong for any doctor to ever take advantage of his patient during nitrous oxide, during sedation, or any of that, but partly it is true. It does happen, and there have been instances, but with nitrous oxide, it can happen. Only with sedation, it will. Most importantly, trust your dentist. Make sure he or she is a trustable person, and he has respect in the community, and everything that is to be done is agreed upon by both parties, by yourself, by the dentist, and whoever else is involved. I'd give this dentist a 1 out of 10. He's doing drugs in the office, he's sedating his patients and taking advantage of them, he's mistreating a kid by stabbing him in the gum. I mean, he's doing horrible things, so he should lose his license. Guys, thank you so much for watching. If you want me to review any other movies or any other shows that you know that have anything to do with dentistry, I'd love to. Just leave the comments below. Also, subscribe to my channel and like the video. And don't forget to watch my other videos. Thank you so much, and don't forget to take care of your teeth.